If your knees hurt when you stand, walk, or climb stairs, or honestly just exist, then this video is for you. I'm Dr. Ethan Kellum, orthopedic surgeon, sports medicine specialist, and yes, a surgeon who actually hates doing surgery. Because for most knee problems, you can fix it without me ever touching a scalpel. So today I'm going to give you the top 10 ways to fix knee pain without surgery. These are the exact things I tell my own patients before we ever talk about an operation. And just so we're clear, this video has zero sponsors. No supplements, no magic creams, nobody paying me to say anything. Just the truth. I mean, maybe a joke or two, so we don't cry about our knees together. Number one, fix your walking mechanics. Nobody talks about this, but it's one of the biggest reasons people develop knee pain. If your toes point out, your knees cave in, or you overstride. Every step is grinding the joint the wrong way. Any tiny gait correction can reduce load by 20 to 30%, and most people don't even know they're walking like a duck. So film yourself walking in front and from the side, or ask a physical therapist to do a gait evaluation. Fix the movement. Fix the pain. It's simple as that. Number two, train smarter, not angrier. If running on concrete makes your knee feels like it's about to explode, then maybe don't run on concrete. I treat athletes who say, "Doc, my knee is killing me." Then I ask what they're doing, and they go, basketball, CrossFit, heavy leg day, all in the same afternoon. My friend, this is not a workout. This is a coordinated attack on your joints, and your knees are losing the war. Movement is medicine, but you don't have to pick the exercises that hurt the most just to prove you're tough. Swap high impact stuff for low impact. Cycling, swimming, elliptical. Your knees will appreciate the break and you'll recover faster. Number three, strengthen your hips. This might shock you, but most knee pain comes from weak hips, not weak knees. When your glutes aren't doing their job, your knees collapse inward and take the hit. Strong hips equals straight knees, which equals less pain. If you want healthier knees, train your glutes like it's your job with bridges, clamshells, lateral band walks. This is one of the fastest ways to reduce knee pain. Number four, physical therapy, or what I like to call teaching your muscles to actually do their job. When your quads, hamstrings, glutes, and calves are weak, your knee takes the beating. Weak muscles equals your knees getting bullied. Strong muscle equals your knees getting bodyguards. The right exercises, even simple ones, change everything. And yes, it takes consistency. But I've had patients avoid surgery entirely with 8 to 12 weeks of good physical therapy. If there's one section in my video you take seriously, it needs to be this one. Quick pause. If you're learning something already, hit subscribe. Every week I teach you how to stay active, stay mobile, and out of the operating room. And trust me, the stuff coming later in this video is important. All right, back to it. Number five, your shoes matter more than you think. Too much cushion, too little heel drop, worn out soles, they all change how your knee absorbs force. If your shoes lean inward or outward when you put them on a table, your knees are paying for it. A proper shoe or simple insole can completely change how your knee feels. This is the cheapest knee pain fix most people ignore. Number six, what you eat affects your knees. Inflammatory foods equals stiff and swollen joints. The biggest offenders, things like sugar, alcohol, processed foods, dairy, and refined carbs. Meanwhile, foods like salmon, berries, leafy greens, nuts, those all calm inflammation. I've had patients who reduce their knee pain 30 to 40% just from diet change alone. Food is definitely medicine, or it's gasoline on a fire. There's really no neutral option. Number seven is supplements. Look, I'm not a supplement pusher. 90% of the stuff is overpriced nonsense. But the other 10%, those can actually move the needle, especially for joint pain. The ones I personally like because the research is solid are fish oil, creatine, and boswellia. Fish oil helps to calm inflammation. Creatine helps you build and maintain muscle, which protects your joints. And boswellia is a great natural anti-inflammatory a lot of my patients do really well with. Now, things like glucosamine and chondroitin have mixed evidence. Some people swear they help, others feel nothing at all. My rule is simple, and I tell my patients this all the time. Try it for 2 to 3 months. If nothing changes, stop wasting your money. Supplements can help, but they're not magic, and they don't replace strength, mobility, or fixing the root cause. Number 8, daily knee hygiene. You brush your teeth every night, right? Do the same thing for your joints. A 5-minute routine, quad stretches, calf stretch, hip opener, and a slow controlled step down. This alone fixes knee pain for thousands of people. Consistency beats intensity every time. Number 9, and I like to call this the alternative category. And look, there's a lot of junk out there. Copper bracelets, miracle magnets, energy stickers, the stuff that your aunt buys at 2 a.m. But not everything in this category is nonsense. One thing I actually do like, and I use myself, is red light therapy. There's growing research showing it can reduce inflammation, support tissue healing, and help chronic knee pain if you use it consistently. Is it magic? Well, no. But is there real science behind it? Yes. The other stuff, magnets, copper, quantum patches, the evidence is extremely weak. But still, about 30% of people feel better with placebo alone, which honestly just proves that the brain is wild. And honestly, if something is safe and it helps you, I'm not mad at it. Just don't spend thousands of dollars on your gimmicks when the basics move the needle the most. Red light therapy, I'm on board with, but magic bracelets, best to save your money. Number 10, injections. Let's talk about cortisone, hyaluronic acid, and numbing injections. And let me be brutally honest for just a second. I am not a fan of blasting cortisone into a knee every 3 months like it's some kind of oil change. Cortisone helps short term, but long term it can break down tissue and actually make things worse. Think of cortisone like borrowing pain relief from your future self, and your future self is kind of irritated about it. The one I do like for arthritis is hyaluronic acid. It's basically a joint lubricant. A lot of patients feel smoother walking and better motion. And for a local anesthetic, well, it's just a numbing medicine. Great for flare-ups, but doesn't last very long. Here's the golden rule. Injections should help you move, not replace the real work. If you're relying on injections just to survive the week, something needs deeper attention. One injection can help, but a schedule of injections, that's just a band-aid. Bonus tip, ice and heat. But let me explain it the right way, because the old rice method is outdated. Ice is great for swelling or for a fresh flare-up, like when you twisted your knee yesterday and it's ballooned up. But for everyday knee soreness, it can actually slow healing because it pauses the inflammation your body needs to repair tissue. Heat boosts blood flow, relaxes the muscles, and helps you move better. Perfect for stiffness. So here's my rule. Ice for swelling and heat for stiffness. If your knee is hot, puffy, and angry, ice it. If it's tight, cranky, or it feels like it needs to loosen up, heat works better. And please don't leave it on for 45 minutes. That's how you get frostbite or burns. Used correctly, these are two of the cheapest, safest recovery tools you've got. Please just don't cook or freeze your knee off. So that's it. The top 10 ways to fix knee pain without surgery. And you probably noticed something. None of these require an operating room. I'm a surgeon who doesn't want you to need surgery because your body can heal when you give it the right environment. And trust me, I'd much rather keep you out of the operating room than bring you into one. Try one or two of these for 2 weeks and watch what happens. Drop a comment and tell me which one you started with. I read almost all of them. I'm Dr. Ethan Kellum. Stay strong, stay healthy, and as always, the best surgery is the one you never need.